In this RCM Roundup, I discuss my top 5 mistakes that often occur during the insurance verification process. Check it out. Hey, Tiffany Robinson here from Beyond RCM, Revenue Cycle Management. Some of you may know me as Coach Tiff. Thank you so much for checking me out on the YouTube channel today. I am so excited to get into our RCM Roundup, the top 5 mistakes that occur during the insurance verification process. This is a list that is compiled by moi, and it is based on my experience, my 26 years of experience working in the healthcare field, particularly around the areas of medical billing, coding, auditing, and clinical documentation. And some of the mistakes that I see that are a recurring theme that happens during the insurance verification process. Now, if you work in the medical field, unless your practice is making, a killing as a self-pay cash only practice, you are likely relying on insurance reimbursement in order for your practice to sustain itself. The insurance verification process is a very important piece of medical practices being able to run successfully, and understanding insurance, how insurance works, what type of questions to ask is crucial to the verification process. So today's RCM Roundup, I'm going to give you my top 5 issues that I see occur related to insurance that cost practices a lot of money. And my hope is that for anyone who's watching, you can be someone who is thinking about entering this field. You can be someone who's entry leveled. You could be someone who's experienced. My goal with this roundup is to give you some additional information and insight to strengthen your skills in the healthcare industry. So number 5, understanding insurance plan and product types. Okay. So when we talk about insurance plans versus the product types, we're talking about a plan like United Healthcare, a plan like Aetna, a plan like Blue Cross Blue Shield, a plan like Cigna. That is the plan. The product type is the type of coverage that the patient elects to have. That can be a PPO plan, that can be an EPO, an essential, a heart plan. A common mistake that practices make is they assume that because their doctor is enrolled in, for example, United Healthcare, and they take United Healthcare PPO, that they can take all versions of United Healthcare. And that is simply not true. A provider can be enrolled in several versions of United Healthcare products and not in the other. So it is very important during the insurance verification process that even if your provider takes the insurance on a regular basis, that you ensure that the version of that insurance, the product, we call that the product or plan type, you make sure that the version of the patient's insurance is accepted and your provider can take that insurance. I see it happen all the time. Number 4, coordination of benefits. Coordination of benefits is essentially when a patient has multiple insurances. This is common with married couples. One spouse may have their own coverage through their employer, and they may also be under their spouse's insurance. It's also common with children, where the child is covered by both parents. Now, the biggest error that I see occur with coordination of benefits from a patient perspective is that patients think that they can decide what insurance they want to use. I've had patients say things like, well, I have United Healthcare and my husband has Cigna, but my United Healthcare deductible is too high, so I want to use my husband's Cigna. Listen, Linda, that's not how it works. Coordination of benefits means that anytime a patient has multiple insurances, both insurances work together to coordinate payment because they want to make sure that there is not an overpayment for the services. And there are guidelines for different scenarios of multiple coverages. And based on those guidelines dictate who becomes the primary and who becomes the secondary. Now, there are instances where if a primary, insurance company doesn't pick up a certain amount of coverage, that the secondary will cover the difference. But that has to be coordinated through claim submission, and it can't be coordinated through the patient or the provider deciding which plan they want to take. Now, I'm gonna throw in a bonus tip, a pro tip for my experienced and my newbies. I have seen in the last 5 to 7 years an increase in what insurance company call recoupments, clawbacks, where the insurance company is coming back, 2, 3, 4, 5 years later, requesting money back because they're saying that 5 years ago, they found out the patient had different insurance. And that presents a problem for multiple reasons. If you work in the insurance industry, you understand that there are filing limits to file claims. And when you fall outside of those filing limits, you can forfeit payments. You have to ensure that the recoupment request is even valid. So I just want to give an added layer of advice to my healthcare professionals. Don't assume that because you get a COB recoupment letter and the insurance company gives you some different insurance company name and member ID that you automatically should turn over those funds. Once you get the recoupment request, you should always call the company that's working on behalf of the insurance company and let them know you received the request and you're working on it. But you also need to make sure that it's actually a valid recoupment request. I cannot tell you how many recoupment requests I've seen where they're saying that the patient had a different insurance, but then when we reach out to that insurance, that coverage was not even active for the data service. So definitely you want to pay attention to those requests and vet them out to make sure that they actually make sense and they're legit requests. You also want to use your recoupment request as proof of timely file in case you do have to route the claim to a different carrier. Because if you have to route a claim from 3 years ago to a different carrier, chances are you're outside of the filing limit and you will need that recoupment letter in order to justify timely file. So just a couple pro tips for you guys dealing with recoupment requests related to COBs. My number 3 top mistake that's made: understanding co-payments versus co-insurance versus deductibles versus out-of-pocket maximums. I have seen a running theme in my profession where patients are being quoted their out-of-pocket maximums and cost-sharing balances incorrectly. Cost-sharing balances are the amount that the patient is responsible for before the insurance company will pay any claims on their behalf. Cost-sharing balances can be copays, can be deductibles, can be co-insurances. All of these cost-sharing balances make up what is called an out-of-pocket maximum. An out-of-pocket maximum is the amount that the patient must pay out of pocket before the insurance company will cover their care 100% outright, right? So when patients are being quoted their benefits, they should never be quoted whatever their out-of-pocket maximum is in addition to whatever their deductible, coinsurance, or copay is. So essentially, let's break this down. If a patient has a $2,500 yearly out-of-pocket maximum, it means that that patient is going to need to pay up to $2,500 in co-payments where applicable, deductibles, co-insurance. They're going to need to pay that out of pocket to meet their out-of-pocket maximum before the insurance company will pay their claims 100%. Oftentimes, well, not oftentimes, but I have heard in many instances where individuals are quoting out-of-pocket maximums in addition to these cost-sharing balances. And that is simply not correct. All 3 of those things count toward the out-of-pocket maximum. Okay, mistake number 2 that I see: understanding coverage limits, okay? There are instances, and this is usually around therapy services. So let's take therapy, for example. There are instances where many insurance companies have coverage limits on what they will consider for a specific service, right? Physical therapy is a common service that has coverage limits. Coverage limits can be in the form of maximum visits that are allowed, or they can be in the form of maximum dollar amount that will be paid for that service. So you can have an insurance company for, say, physical therapy where they will say, we cover a maximum of 20 visits for physical therapy per year. That means that if you have a patient that has 24 visits, 20 will be covered by the insurance. The other 4 will not and will be the patient's responsibility. Or on the flip side, you can have a coverage limit that says, we pay a maximum of $5,000 for physical therapy annually. That means that once you have been paid up to $5,000 worth of reimbursement for your services as it relates to physical therapy, the insurance company will no longer make any payments towards that service, and anything above that $5,000 becomes the patient's responsibility. So it's very important for practices who have specific services that are subjected to coverage limits to understand what those coverage limits are, how it affects the patient's treatment plan, and make sure that you communicate this with the patient appropriately so that the patient doesn't get bills that they didn't anticipate getting for those services, okay? And my number one, oh my gosh, drum roll please, my number one mistake that I see taking place during the insurance verification process is relying too much on technology without supervising its results, the output. We are in an age where we're in the midst of a tech revolution. I talk about it all the time. I've talked about it in several videos. We're in the midst of a technological renaissance. And there are people that think that this technology gonna do everything for us and we're not gonna have to use our brains no more. And that is simply not the case, you know? I have been in this industry long enough to see a lot of advancements. I think we've advanced tremendously and there are tools that make us very efficient. But I also feel that as these tools come out, there is a false sense of security thinking that these tools are going to solve everything and you are not going to need humans to use their brains. Humans, please understand, y'all gonna still need to use y'all brains. So common issues that occur with tech as it relates to insurance verifications, it could be very simple. Take, for example, copay amounts. If you are a specialist, so say, you know, an orthopedic doctor, and you're running your eligibility using, you know, online tools, it is very important for you to understand the difference between a PCP out-of-pocket expense versus a specialist out-of-pocket expense. And you have to figure out what to charge the patient. If you're an orthopedic doctor and your staff is reading an eligibility report, and there's a $20 primary care copay versus a $50 specialist copay, that patient should be charged the $50 specialist copay because you are a specialist. There are times where you are working in a practice where a patient is going to have a visit and also get laboratory work done on site at the same day. Oftentimes when staff members are reviewing the copayment information, they will only quote the patient the office copay, but that patient may also have a laboratory copay and should be quoted for that information as well. So very important that as that information is being given to you from these various sources of verifications via website portals, it's important for you to know how to interpret that information and communicate it to the patient effectively so that the patient doesn't get an added bill down the road that they didn't anticipate. Another area where tech fails when it comes to the verification process is the dreaded retro-termination. So retro-termination occurs when a patient comes in, you verify their insurance on Monday, insurance comes up active on Monday, but then you send out your claim and you get a denial, the dreaded denial saying coverage not in effect on date of service. And usually that happens because at the time of verification, the patient was still showing up in the insurance company's system as active, but then the system updated after that and you found out the patient left their job last week. And when they left the job last week, the coverage ended last week. And therefore, you ain't getting paid by this insurance for this date of service. Now, there is really no foolproof way to prevent this type of thing from happening, but I want to offer a best practice. And a best practice tip would be having patients, as they're being triaged for new visits, answer questions such as, have you changed employers or has your insurance changed? Now, usually, hopefully, the patients are honest and they communicate that with you. Also, there should be disclaimers in the paperwork that let the patient know that in the event the insurance is not active, that they will be responsible, right? So just keep in mind, these are all instances where tech can fail us, where we're relying on technology to give us a 100% accurate output, but then we either have to pay attention and make sure that we're reading and we're interpreting the information correctly, or at the time we were given the information, something changed and that information that we thought was accurate was no longer accurate. So those are my top 5 issues that I see, or top mistakes that I see happening during the insurance verification process. If you have any common mistakes that you are seeing occur during the insurance verification process, please drop us a comment and let us know. Sharing is caring. And if you're interested in getting more in-depth information as it relates to insurance verification, I do want to encourage you to check out our Insurance Verification Masterclass. We currently have a summer sale going on, That sale ends when summer ends, and I'm really excited to announce that we will be immediately launching our next masterclass once that occurs. But this class is going to give you, if you thought that this video was good, this class is going to give you 80% more of what you got in this video. And I want to thank everyone who has already taken our course and have given us tremendous feedback. One of our students, for example, is Tangela, and I'm going to pop her comment here. Tangela took our course and she loved it. It helped enhance her knowledge base. She is an experienced healthcare worker. She works in the healthcare space, but she wanted to deepen her understanding of insurance verification, and our course did just that. So I was very excited with her feedback because the exact reason why I created this course, she was able to benefit from that. So I am forever grateful. So thank you for hanging out with me today. I'm Tiff, Coach Tiff, Tiffany Robinson. My newbies, I hope you guys found this very interesting. If you have any questions, please feel free to drop them in the comment section. Like, subscribe, and hit the notification bell. And I will see you in the next RCM Roundup. Peace out.